you thinking about getting a new IUD inserted or removing an old one? Or have you possibly just come home from having an IUD inserted and have no idea if this procedure makes you Niddah or if the bleeding afterward makes you Niddah? Well, we're going to help you out in this video. Nishmat Rabbanim follow the view that this procedure does not in general make you Niddah. If there's cervical dilation beyond a certain amount, even without bleeding, that can make you Niddah. But since with insertion or removal of an IUD, generally the instruments used are not greater than 19 millimeters, then you don't have to worry. If your personal posek holds differently, then you should ask the doctor or the person who did the procedure how large an instrument was used. What about bleeding that occurs shortly after insertion or removal of the IUD? So in that case, bleeding that occurs immediately and lasts up to a day or two can be attributed to the trauma caused to the site, and it's called dam makah. But bleeding that lasts longer than a day or two, or begins, let's say 2 days after the insertion or removal, can't automatically be attributed to the wound at the site, and you should be asking a question in that case. Following insertion or removal of a hormonal IUD, which is also called an IUS, in that case, we need to be a little bit more concerned about bleeding, especially the bleeding that begins, let's say, a day or two after the insertion or removal of the IUD. In that case, that would be another instance where one should go and ask a question. In all of these cases, they can't be attributed to a makah, then the laws of staining apply. You can also look at the Nishmat website for more about staining, but in general, if you follow the rules of being careful, let's say, about wearing colored underwear and being careful with toilet paper use, right? Not wiping immediately, but waiting, then you have a good chance of heading off any questions that might occur. If you haven't yet scheduled your appointment, we have another tip for you, and that is that you should try to schedule your appointment after your immersion so that the bleeding following the insertion or removal does not complicate the Shiva Nekiim. If your procedure is scheduled for the Shiva Nekiim, we highly recommend you do the bedika for that day beforehand and then wait another day before you do your next bedika. If you have further concerns and questions about following bedikot till the end of Shiva Nekiim, feel free to reach out to us. Keep in mind that you'll need a short-term solution for after your immersion and before the IUD is inserted for birth control. And remember, we're here to help you with any IUD questions or other questions that you have about the procedure.